So I'm with Dr. Shelby Brogdon of Little Rock, Arkansas. And Dr. Brogdon, congratulations on your new article in Optometry Times. I just wanted to ask a couple questions about it, and if we can just go over it really briefly, it'd be great. So the first question I had is, tell me about this case. This is a patient that you had seen in the office, correct?
Yes. So it's a patient that was actually sent over to me from one of my ophthalmologists. This patient was interested in refractive lens exchange, but was having lots of dryness and irritation. So they sent him over to me first to try to get that under control. And then when I took a look at him as a 55-year-old male, his complaints were foreign body sensation, irritation. Um, really just grittiness. It was worse when he woke up in the morning. It would get a little better throughout the day. And then towards the end of the day, he was kind of, getting worse again. And so when I took a look at him, it was a pretty typical case of SLK. He had lots of redness, lots of irritation, but when I had him look down and I pulled up that upper lid, it was way worse under those lids. And then when I put in some fluorescein stain, he also had conjunctival staining and some staining at the limbus on the cornea too. So based on kind of his symptoms and then kind of the signs we were seeing in the office, he has some concurrent dry eye as well, but the main issue that we want to take care of first was the SLK.
Sure. Yeah, and I think that's a good point is that I personally don't really ever think about think about how the redness is more focal or localized underneath the lid, especially on the superior thing, to really consider SLK because like you mentioned, I think it easily can be misconstrued as just, your run-of-the-mill dry eye patient, which is not really the case. So what was he taking prior? So what was his kind of home regimen before you had seen him? What was he doing?
Yeah, so he'd been seen a couple times in the office before he got referred over to me. And at the time, he was just using preservative-free tears like 6 times a day and then a gel at bedtime. And that was all he was doing.
Gotcha.
He
And
wasn't
so,
moving.
and so traditionally, what was your kind or how have you previously kind of treated SLK or what has been your approach in the past?
Yeah, so it's kind of been hit or miss, just kind of honestly, just kind of playing around with things, trying to figure out what works because there's really not a like standard of care for
Right.
what to do. So I've had some success with some steroids in the past. Um, and with frequent artificial tears, gel or ointment at bedtime. I find sometimes the ointments that have the vitamin A in it help a little bit too. But really, it was just lots and lots of drops
Sure.
for a couple weeks or months, which I know patients sometimes get annoying, and then
Uh-huh.
that compliance goes down. So
Right. Right.
it was kind of most of the time a really annoying thing for patients.
Absolutely. And so, in your situation, I know that's what clearly the case was about, is that you incorporated Rinsada into the treatment algorithm pretty much early on at the immediate visit. Um, Tell me before we kind of go into that, how has your experience with Rinsada, previously been? Where had you been putting it into your practice? And then what made you decide to kind of incorporate this in this particular patient, this SLK patient?
Yeah, so I've been using it a lot just in my dry eye patients, those who have, quite a bit of inflammation on the surface. It pairs really well when I'm just starting them on IPL or radio frequency. I kind of just throw it in on that first session just to really kind of jump start their progress. And I found it's been super helpful there. And then there's a few kind of cases here or there that have kind of popped up when someone's having a flare, just to try to get, some of that inflammation under control faster.
Sure, sure. And then how did you decide kind of to incorporate this for the SLK patient? What was really ultimately the outcome?
Yeah, I really was just I just felt bad. He was in a lot of pain and really frustrated, and I really wanted to give him something where he could. So the day I saw him, I did the Rinsada in office that day. So I wanted to get him out the door feeling better, and he did. He was like, okay, like I can tell a difference, immediately after. And then we started him on lifitegrast with Xiidra to kind of address some of the inflammation too. And then I've had some good success with MyBo as well, just helping prevent some of that friction that comes along with
Sure.
SLK. So I started him on both of those and switched him over to the ointment. I like the Optase High-Low Night that's got that vitamin A in there for the mucous membrane. So I started him on that at nighttime. And then I saw him back just 10 days later and he was doing a lot better.
That's great to hear. Well, I appreciate it. Thanks so much for taking time to chat with me, Dr. Brogdon, about how you've incorporated Rinsada and kind of this very unique case that you presented recently in Optometry Times in the September 2024 issue. So thanks again.
Awesome. Thank you.
Of course.